the Latino Commission on AIDS developed, I will say, since the beginning, a commitment to promote community mobilization. Why? Because we're dealing with a public health crisis. HIV/AIDS affect all the communities. HIV do not discriminate. And since day one, we developed that vision and commitment of recognizing that without community mobilization, meaning that not only to engage but also to motivate people to do something, we will be able to not only raise awareness but also to promote a commitment, a sense of one community united to respond to the terrible impact of HIV/AIDS among all communities. We believe that the best way to do it is to try to convince not only leaders, for example, religious leaders. That's a perfect way to recognize that if you're able to convince, engage, work with them, they are very important leaders, they're opinion makers, but also they will encourage community at the neighborhood level, their own parish, their own congregations, to do something about this crisis. And when you engage non-traditional partners, it's even better, because we are able, before somebody else convince them and probably deliver the wrong message, we are able to engage a very important segment of our nation to speak from a positive perspective, to encourage people to take the test, to learn about the basics about HIV, to understand how relevant preventive medicine approach is in terms of keeping our communities healthy, and many other things. And I believe also, we also strongly believe that in order to promote an effective community mobilization, we need to invest and engage media outlets. And not only television, radio, TV, now with social media is even a wider or more diverse venues to promote people to do something. And I believe the same way that, when we watch a commercial that motivate us to drink a new brand or to try a new type of clothes, we need to also convince people to make healthy choices. The models that we promote and that we encourage other community partners to use is always to try to measure how effective the community mobilization is. For example, with National Latino AIDS Awareness Day, we not only ask people to organize a date of testing or a health fair where we're going to be promoting different screening tests, not only on HIV but on diabetes and other type of disease. We always ask people to try to learn from the people that attended how they learned the information, how beneficial was the participation in a particular event that was, at the end of the day, a good venue to encourage people to mobilize from their houses, their apartment buildings, to a particular location to learn something new, and also help us always to be very committed to try to improve any type of community mobilization strategy. We always need to remember that it's a lesson, and the people that will give you the feedback will be the participants. And then somehow we need to remember to always be community-centered, individual-centered, and be sensitive about whatever community mobilization that we will do, that we will never stigmatize or we will not promote a stigma against anybody, meaning to put a label of a particular community. And And I'm proud to share with all of you that for 21 years, I will say the Commission not only will reaffirm to continue promoting the importance of community mobilization, but also always learning from our other brothers and sisters from the Pacific Islander community, Native nations, African Americans, that they unique models of mobilizing their communities are always lessons for us, and I'm sure we will always open and willing and able to share also our experience, because at the end of the day, what I believe we need to share as a common goal is that community mobilization must aim to reach healthy communities, and I believe that will be the best testimony of commitment, the best testimony to build a strong and healthy nation, especially during these difficult financial and social times that we're facing. That's basically my message in terms of community mobilization. Thank you.